Hello, my name is Jane and I have been diagnosed with thyroid cancer. Okay, so most of my friends that know me know I'm rather a quiet person, quite a private person. I don't like to be centre of attention or anything like that. So I'm quite nervous about doing this video. Um, but I wanted to do this in the hope of raising awareness on a particular type of cancer that is considered rare and it's predominant among females. Um, there's lots of things in the media regarding cancer and being aware of changes going on in your body that could indicate a problem. For example, last night I was watching something and an advert came on the TV promoting cervical screening. So we've all seen adverts like that. You know, if you've had a cough for more than 3 weeks, there could be something there. Or if there's changes in your poo, blood in your wee, things like that, looking for lumps and bumps on your boobs and your balls, things like that. But there's never anything that I've come across in the media, or in magazines, social media, anything like that which relates to thyroid cancer. So here I am, having been someone with thyroid cancer, to hopefully spread awareness about that and get people looking for signs and symptoms. Thyroid cancer is a really rare type of cancer, as I mentioned before, but it's, for want of a better word, it's one of the better types of cancers if you're unfortunate to get in the first place. In terms of being cured, there's a sort of 90 to 95% cure rate for this, even if it's gone elsewhere in the body. So that's really good, and that's positive for someone like me as well. Now, your thyroid gland, it's a small hormone producing gland, and it sits, here's a little clue, just above your collarbone in men, between your collarbone and your Adam's apple. It's a small butterfly shaped gland that sits there. Anyway, I'll tell you about my story. My story began about 5 years ago. I was pregnant with my twins, and I noticed a swelling on the front of my neck. I was nearing the end of my pregnancy. Didn't resemble much of anything human, let alone anything else. I'd got lumps and bumps and swellings everywhere, so I wasn't too worried. So I thought I'll wait until I've had the children, and then I'll go to the GP and see what they have to say about it. Well, once things had sort of got back to normal, perhaps not in my head, but sort of body wise, after having the twins, I noticed there was a bit of a lump there once the swelling had gone down. So I went to see the GP, promptly referred me to ear, nose and throat. I saw them within a couple of weeks. I had an ultrasound scan, had biopsies, things like that. They all came back normal. So the consultant that I saw said he wasn't too worried. It looked like it was a colloid nodule of the thyroid, which are really, really common, and not to worry about it. It wasn't giving me any problems. There wasn't really a need for surgery. It was quite small. So I was quite happy to be discharged and just forget all about it. And fast forward 5 years, I hadn't really took any notice of it myself, but as a nurse, I was working amongst colleagues who had said to me, Jane, that looks like it's getting bigger. Again, I hadn't really noticed it, but so again, brushed it off. But what really sort of made me actually wonder was when patients were saying to me, what's that on your neck? What's that there? Whereas people hadn't really noticed it was there before. So I thought, I'll go back to the GP. So again, I was referred back to ear, nose and throat. Saw a consultant in August just gone. So again, nearly 5 years later, and had more scans, more biopsies on it. Again, it came back normal, but because of the size of it, they offered me surgery, which initially I turned down because I didn't want this lovely little scar on the front of my neck. And I didn't really have many symptoms. It wasn't bothering me too much, so I thought I'll leave it. But then over Christmas, I got a little niggle, which I think is again the message I'm trying to get across. If you do have a little niggle about something, to sort of pursue it. Anyway, I got this niggle, so I went back to the consultant who agreed to do the surgery, like I did in the first place, and had my first lot of surgery in February, on February the 18th. They just removed the right side of my thyroid, because that was the area that was affected by the growth. After surgery, he came to see me, said there was no problems. He didn't think that there was anything malicious there, but it'd be sent off anyway. Well, unfortunately, I got a call 8 days later telling me that I'd got cancer. So before I knew it, I was back in theatre exactly 2 weeks after I'd had the first surgery to have the rest of my thyroid removed. So it was a bit of a shock. I'm just a normal 41-year-old woman, got children, district nurse, and despite being a district nurse and caring for people all the time with cancer, you still don't expect that it's going to be you. It's always other people that you know of, so it was a bit of a shock. But again, like I mentioned earlier, I'm not doing this video for sympathy. Please, no sympathy, because actually I don't think there's too much to worry about with this, because the cure rate is so good. It is literally for awareness, so I'm not bothered about all that. I just really would like you to watch this video and share any information that I give. So I just wanted to sort of touch on the signs and symptoms really of thyroid cancer. So the main sign or symptom is bulging, protrusions or swellings, lumps at the front of the neck, as you can see sort of around this area. Other symptoms are swollen glands. You've got lymph nodes all around your body, sort of around here, down the sides of your neck and along here. Anything that's swollen on there that isn't usually needs checking out. A constant sore throat that won't go away, that's another sign and a symptom. Hoarseness of the voice, mine's a bit like that since having surgery, but it certainly wasn't at all before. Pain, difficulty swallowing. I must admit, although I didn't really have anything much that was bothering me, if I was finishing a drink, for example, you know, knocking back the beers in the pub, sort of near the end of the drink, sort of putting my head back and swallowing, I was aware of some pressure there. So, you know, that's something to take note of as well. Breathing difficulties. Some people with sort of lumps or pressure on the neck might wake up in the night coughing or whatever, because when they relax, it's sort of pushing back on their larynx or what have you. Occasionally, with thyroid cancer, it's noted that because it's a hormone-related gland, some people might get diarrhea or flushing associated with that, but that's not something that happens very often. Okay, so where this is leading is that I would like people to be conscious of how their neck feels and to check themselves regularly. Hopefully you all know to check your balls and your boobies when you're in the shower or bath, things like that. Why should you not check around elsewhere? Check around your neck as well. So if you're having a couple of minutes to have a little fumble down below or on your chest, just have a little poke and a prod around here as well. So the way to check your thyroid is to feel just below your ears. Your thyroid's not up there, by the way, but these are glands and sort of things that could be swollen if there is a problem with the thyroid. So have a little feel sort of below the ears, trace it down the neck at the front, up and down like that. Don't press too hard, because if there are any lumps and bumps there, you might press them in and not notice they're there. So don't press too hard. Feel along the collarbone as well, both sides, and sort of feel if there's any lumps or swellings around the front as well. Also, another good way of checking if you're not sure is to stand in front of a mirror or have a handheld mirror and have a small sip of water, or if you kneel tuckly, have a drink of gin. But have a small drink of water. Tilt your head back slightly, and as you swallow it, just observe what's going on with the front of your neck. If you notice any bulges or protrusions or anything like that, sort of move up and down with your gullet as you're swallowing, that might be a sign that you need to go and get that checked out. I do have a video. I found one video. I wished before surgery actually that I'd have taken a video of myself swallowing just for people to see, but I didn't think that I'd be doing something like this, so I didn't. But I have actually found one video of myself where I was sending a a video to a group of friends. We were discussing something, and I do swallow partway through the video, and you can actually see quite a lump sort of move up and down as I'm swallowing. So I'll post that in the comments section, so that you can have a look and see exactly what I'm on about with regards to lumps at the front of the neck. So I probably rambled on a bit in here. Like I said, I'm quite nervous, but thank you very much for watching this video. I hope you did make it through to the end. I would really, 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 really appreciate it if you could fast forward this on, share this with your friends and family, particularly female friends and family, but this is something that does affect males as well, but it's predominantly female friends and family. If you could share it amongst them, that would be really great. Like I said before, I'm not after any kind of sympathy. I don't think I really need that. I don't want it. And I'm not after copious amounts of likes or anything like that, but I am after lots of shares, and I would really, really, really appreciate it if you would get the shares out there. I think the lesson to be learnt for me is that if you have any lumps or bumps, even if you're told, like I was repeatedly, that they're okay, they're not cancerous or anything like that, if they're not supposed to be there and you are worried about them and you do get a niggling feeling, see somebody, get a second opinion, remove them. I in no way hold anybody accountable for missing this diagnosis over this last 5 years. It could be a case that it was benign and it's developed later on, or scans and biopsies, they're not always accurate. So I think the message that I want to get out here is, if you are not sure about something and something is niggling away at you, then just seek further advice, get a second opinion, and get those lumps and bumps taken away. Continue to check your balls and your boobies, but also check around your neck and your throat as well. Make that part of your routine as well, just to make sure there's nothing untoward going on there. Thank you very much for taking the time to watch this video. I really appreciate it. Thank you. Take care. Bye.